A review of COVID-19. By the end of the session, participants will be able to state what COVID-19 is and its origin, discuss means of transmission of COVID-19, explain strategies to prevent transmission of COVID-19, describe what personal protective equipment are and when they should be worn. The coronaviruses are a large family of viruses that are found in animals and humans. Human coronaviruses have been around for a while and were first detected in the mid-1960s. Some coronaviruses that infect animals can make people sick and become a new human coronavirus. Examples of these include Middle East Respiratory Syndrome or MERS-CoV, Severe Acute Respiratory Syndrome or SARS-CoV. The new strain was recently detected in Wuhan, China, the 2019 novel coronavirus, now called COVID-19. The CO is the first part of the coronavirus. The VI stands for the virus. D is for the disease. And 19 is for the year 2019, and that's where the name COVID-19 comes from. COVID-19 situation in the Bahamas. As of the 26th of April 2020, the Bahamas had 80 confirmed cases of COVID-19, with 22 recovered cases, 792 total persons in quarantine, and 11 deaths. And worldwide, there have been more than 2.9 million confirmed cases, more than 853,000 recovered cases, and more than 205,000 deaths. Now, the symptoms of COVID-19 may appear 2 to 14 days after someone is exposed to COVID-19. A person is exposed if they are in close contact with an infected person, if they're living with a sick person who has COVID-19, or if they're caring for an infected person. Also, if they come in contact with respiratory droplets from an infected person who was coughing, talking, laughing, etc., or used unwashed eating or drinking utensils used by an infected person. Persons with confirmed COVID-19 infections have illnesses ranging from little to no symptoms to having severe illness or even dying. Symptoms of COVID-19 include respiratory illness with fever, cough, shortness of breath, and difficulty breathing. In severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, or even death. COVID-19 may be spread from person to person if an individual is in close contact with someone who has this virus. If an infected person coughs or sneezes, speaks or laughs, they may release respiratory droplets in the air or onto surfaces. Someone can become infected if they inhale the droplets or touch the surface where the droplets have landed, then touch their eyes, nose, or mouth. The best way to prevent COVID-19 infection is to avoid being exposed to this virus. Stay at home as often as possible. Practice physical distancing. Stay at least 6 feet away from others. Wash your hands properly and often. Wear personal protective equipment or PPE. As healthcare professionals, it is important that you wear personal protective equipment or PPE as required when interacting with your patients. PPE includes surgical masks, gloves, gowns, shoe covers, and face shield or goggles. Proper application and removal of PPEs is also important to reduce transmission. Wear new PPE with each patient. Now, when you're wearing your personal protective equipment, the sequence that you put it on is very important. So the type of PPE used will vary based on the level of precautions required, such as standard and contact, droplet, or airborne infection isolation procedures. The procedure for putting on and removing PPE should be tailored to the specific type of PPE. So when you're putting on a gown, fully cover torso from neck to knees, arms to end of wrists, and wrap around the back. Fasten in back of neck and waist. The next is mask or respirator. Secure ties or elastic bands at middle of head and neck. Fit flexible band to nose bridge. Fit snug to face and below chin. Fit check the respirator. Number 3 is goggles or face shield. Place over face and eyes and adjust to fit. Number 4, gloves. Extend to cover wrist of isolation gown. Keep your hands away from your face. Limit surfaces touched. Change gloves when torn or heavily contaminated. And of course, you want to perform hand hygiene. Remove all PPE before exiting the patient room except a respirator if worn. Remove the respirator after leaving the patient room and closing the door. Remove PPE in the following sequence. Number 1, gown and gloves. Gown front and sleeves and the outside of gloves are contaminated. If your hands get contaminated during gown or glove removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp the gown in the front and pull away from your body so that the ties break, touching outside of the gown only with gloved hands. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Place the gown and gloves into a waste container. Number 2, goggles or face shield. Outside of goggles or face shield are contaminated. If your hands get contaminated during goggle or face shield removal, immediately wash your hands or use an alcohol-based hand sanitizer. Remove goggles or face shield from the back by lifting headband and without touching the front of the goggles or face shield. If the item is reusable, place in designated receptacle for reprocessing. Otherwise, discard in a waste container. Number 3, mask or respirator. Front of mask or respirator is contaminated. Do not touch. If your hands get contaminated during mask or respirator removal, immediately wash your hands or use an alcohol-based hand sanitizer. Grasp bottom ties or elastics of the mask or respirator, then the ones at the top, and remove without touching the front. Discard in waste container. Number 4, wash hands or use an alcohol-based hand sanitizer immediately after removing all PPE. Perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE. Next, we're going to talk about wearing a face mask. It is important to put on and remove the mask properly. Your hands should be clean when you put on a face mask. Avoid touching the mask once you have it on. Remove the mask from behind the ear, not the front of the mask. Discard the mask in a covered trash bin. Wash hands immediately afterwards. If you are a healthcare professional, you should wear the medical masks at the workplace. Otherwise, you can wear a cloth face mask to go to the grocery store or to the pharmacy. Wearing a mask provides protection for you and as well as those you may come in contact with. Masks are only effective when used in combination with frequent hand washing, with soap and water, and other preventive measures such as physical distancing and not touching your face. Wash your hands. Wash your hands often throughout the day. Wash with soap and water for at least 20 seconds and make sure to cover all surfaces of the hand. Rinse well, then dry your hands with single-use disposable paper towel. Use hand sanitizers with at least 60 to 70% alcohol to clean your hands if soap and water are not readily available. Washing your hands or using alcohol-based hand sanitizer kills viruses that may be on the hands. Do not touch your face with unwashed hands. Avoid touching your eyes, nose, and mouth because you may be introducing the COVID-19 virus into your body and making yourself sick. Make sure that you, as well as the people around you, follow good respiratory hygiene. Cover your mouth and nose with tissue when you cough or sneeze. Throw the tissue away right after use and wash your hands immediately. Cough or sneeze in your bent elbow if you do not have tissue. Never cough or sneeze directly into your hands or in the air. Following good respiratory hygiene prevents the spread of viruses. Clean and disinfect all surfaces and objects that are frequently touched. The common household disinfectants can kill viruses. According to the World Health Organization, studies have shown that the COVID-19 virus can survive on certain surfaces for hours to days. Surfaces such as tables, chairs, light switches, remote controls, keyboards, telephones, cell phones, toilets, water faucets, doorknobs, bed rails, etc., should be cleaned and disinfected on a regular basis throughout the day. If you develop any symptoms of COVID-19, such as fever, cough, or trouble breathing, stay at home. Call your healthcare provider and they will advise you of what to do. Do not go to a healthcare facility without first speaking to a healthcare professional. This will ensure that they are prepared for your arrival and are able to protect themselves, other staff, as well as other patients. Quarantine refers to the restriction of movement as well as the separation of persons who are well but have been in contact with persons identified as having COVID-19 or have visited an area where there is community spread of the virus. Persons advised to quarantine at home should do the following. Do not allow visitors. Stay in one room that is separate from others. The room should have open windows and be well ventilated. Have one person bring them their meals and leave it at the door. Use a separate bathroom from others in the house if possible, or be the last person to use the restroom, then have someone clean and disinfect it afterwards. Avoid physical interaction with other people until the period of quarantine is complete, as advised by the healthcare provider. It is important to stay safe and to keep your patients safe. Everyone has a responsibility to keep themselves safe, but as healthcare providers, you must keep yourselves and your patients safe from this disease.